Alrighty, so welcome to this webinar on compassion fatigue. Today we will be going over what exactly compassion fatigue is, where it comes from, some signs and symptoms to look for in yourself and in others you might work with or know of, and then also some steps to take to decrease your risk for compassion fatigue personally or within your organization as a whole, and how to promote resiliency within your organization. So the first thing that I would like to do is I'm going to have you all take a poll to gauge your baseline or familiarity with compassion fatigue. So that will go ahead and pop up on your screen here, and you can pick whichever option is true for you. And I'll give you guys another 30 seconds or so here. We're about at 50% completion. Okay, so I'll go ahead and close this poll. Thank you all for participating, and I'll share these poll results in just a moment. In the meantime, what I would love from all of you, if you could put in the chat box a definition or your thoughts on what compassion fatigue is, or what does it mean to you in your life. And then I will highlight some of the responses that we get here. So Kathleen says, feeling what the other person feels. That's definitely part of compassion fatigue. Absolutely. Thank you. And as we're having those responses come in, I'll go ahead and share these poll results with you all. So we can see here that we're pretty evenly split. So about 25% are very familiar with what compassion fatigue is. 25 don't know what compassion fatigue is at all. And then 20 about that has heard of compassion fatigue, but maybe that has been the extent of their education around compassion fatigue. And 50% of the poll participants believe that they've experienced compassion fatigue, and we will discover that it is very, very common, especially in this population, you all working in or around healthcare. So Diana says that it means to her that she doesn't have any empathy for those that she's taking care of or any for herself. And yeah, it makes every day that you're having to be a caregiver a bad day, and there's not that personal time for rejuvenating and recharging. Jenna says that to her, compassion fatigue means becoming calloused after continued overwhelming exposures to something. And Lisa says, feeling overwhelmed or worn down when working as a caregiver. And those are really great points that you all bring up. And for those of you that might have answered that you don't know what compassion fatigue is, you might not have ever had training formally in compassion fatigue, but maybe you can relate to these experiences that Lisa and Jenna and Diana are bringing up about feeling overwhelmed or calloused and worn down as a caregiver. And Ashley says compassion fatigue to her caused her to be unable to effectively therapeutically treat her clients. The lack of support professionally and personally, and it traumatized her and made her feel as if it wasn't a good caregiver. Those are very important points. Compassion fatigue can really take a toll on the people that it affects, both personally and professionally, and can make us feel as though we aren't good caregivers, which can be very disheartening. So thank you all for all of that great input. We will go ahead and hide these poll results now. And let's start off with a brief introduction to what compassion fatigue is. So it's a pretty new concept that we have put a definition on what we can experience as caregivers, that feeling of being worn down, being tired of giving, being unable to give anymore, and feeling as though you're just not enough. So it's about 30 years old, this definition of compassion fatigue. It was first coined in 1992 to describe the loss of the ability to nurture observed while studying ER nurses. And then in 1995, Dr. Charles Figley, who is a pioneer in the study of compassion fatigue, took a turn in the research and started to define it as a secondary traumatic stress disorder. And a secondary traumatic stress disorder means that you can indirectly experience the trauma of your patients. So this trauma can have lasting effects on us as caregivers. And Dr. Charles Figley said in his research, he found that there is a cost to caring. Professionals who listen to clients' stories of fear, pain, and suffering may feel similar fear, pain, and suffering because they care. Sometimes we feel as if we are losing our own sense of self to the clients we serve. And you might notice that secondary traumatic stress disorder sounds very similar to post-traumatic stress disorder. And if we look at what the differences are between the two, in post-traumatic stress disorder, you are directly experiencing that trauma. And in secondary traumatic stress disorder, you are indirectly experiencing somebody else's trauma through hearing about it or seeing it. And so a trauma, to just define that, is an experience that we don't have the capacity or skills to cope with. So trauma is a huge, broad subject, and it can include a lot of things that we don't necessarily think of as trauma. And trauma has a lot of effects on our body because our body reacts to perceived threats and it wants to keep us safe. So some of those reactions to trauma can be intrusive reactions like dreams, nightmares, obsessive thoughts, physiological reactions like fight or flight. They can be avoidant, so general numbing of all of your emotions or avoiding things that are going to remind you of that trauma. And then the third reaction is hypervigilance and difficulty concentrating. So always being on edge, always being ready to protect yourself or defend yourself. And so these reactions to trauma are very similar regardless of whether that trauma is primary from a source that you experienced or indirectly from an experience you had listening to or seeing someone else's trauma. It's just going to be your body trying to protect you from that perceived threat. And we see a lot of these reactions to trauma in the symptoms of compassion fatigue. So in general, the hallmark is a chronic emotional and physical exhaustion. Now, this can include a lot of things: somatic symptoms like headaches, sleep disturbances, insomnia, gastrointestinal distress, negative shift in your worldview, a preoccupation with the illness of others, whether your clients or the suffering of the world in general numbness or apathy, feeling overwhelmed, irritated, or empty, feeling as though you just have nothing left to give. And compassion fatigue in an organization can have some seriously devastating effects. Compassion fatigue promotes depersonalized, suboptimal care that lacks empathy and compassion, and it fails to meet patient needs. We see an increase in clinical errors. We see higher rates of depression and anxiety disorders in caregivers experiencing compassion fatigue. We see high absenteeism and lowered job satisfaction and job productivity. And then also, we see that these effects spread into these caregivers' personal lives as well. It can cause a decreased ability to connect with loved ones and friends, which can lead to increased rates of stress in the household, divorce, and social isolation. And this point really is a good point to stop on to talk about the difference between compassion fatigue and burnout. And now these can be occurring at the same time and are fairly interchangeable when we talk about them in general conversation, but burnout usually is only in your professional sphere. So that decreased job satisfaction, decreased productivity because of chronic stress at work. And the solution for that usually is to switch jobs, switch patient populations, switch job responsibilities. Whereas compassion fatigue follows you home, it's going to follow you from job to job. The solution is not simply to work with a different patient population. The solution is a little bit more complex. And the next question here is, well, who does compassion fatigue affect, or who is at risk for compassion fatigue? Well, really anyone who is a helper. And that are so many people in the world who are in the helping professions. Doctors, nurses, anyone in healthcare, teachers, firefighters, police officers, anyone who is working towards decreasing the suffering of other individuals. And that suffering could be emotionally, spiritually, or physically. So we have a huge population here. And these people are affected because they have a very strong empathetic response. You can usually see that from why they entered the work in the first place. So they usually entered the work because they want to make a difference in the lives of others. They want to change the world one person at a time. And so they have that really strong empathetic response that they can tune into to feel the pain of others. And that's a very strong motivator to want to go out and help others. Now, you don't have to be a paid helping professional to be at risk for compassion fatigue. If you perform a helping role at home or in your community and this is unpaid work, you are most definitely at risk for compassion fatigue as well. And it is a pretty staggering number of adults in the United States who act as caregivers at home. 20% of all US adults act as caregivers for either a family member or a friend. And so that could be a double whammy for some of these individuals where they're in a helping profession at work, but then they're also in this unpaid role at home as well. And it can be very disheartening to hear about compassion fatigue because it seems like it affects the very core of what brings helpers into their work, their empathy and compassion for others. So then the question that you might ask yourself is, well, if I am a helper and helpers are at high risk for compassion fatigue, is it inevitable that I am going to get compassion fatigue at some point in my career? The answer is no, it is not inevitable. We can definitely take steps to prevent compassion fatigue in ourselves individually and also in our organizations. The second question is that if compassion fatigue is the problem we're talking about here, is the solution to simply be less compassionate? And the answer to that question is also no. That is not the solution to compassion fatigue. And as we work our way through this presentation and come to what promotes resiliency in individuals and in organizations, I hope that you can learn a few skills that you can bring with you into your work to decrease your risk for compassion fatigue. All right, so the next topic I'd like to speak about is generally understanding what compassion is and what empathy is and how they are different from one another, because there are some very important distinctions that we should make. So empathy is the ability to understand, resonate with, and share the feelings of another, both positive and negative feelings. So this is really the ability to feel somebody else's pain as if it was your own pain. And we can see this in some emerging neuroscience, some research that has come out that there are two different neural pathways used in empathy and compassion. In empathy, when we feel someone else's pain, the same neural pathway lights up as when we feel pain as well. So it's not just theoretically or figuratively that we are feeling someone else's pain, but we're feeling that pain in a physiological sense as well. Compassion, on the other hand, is an awareness of another's distress together with the desire to alleviate it. So empathy is not feeling someone else's pain, but understanding that pain and wanting to take a step further and ask, how can I help with this? Now, empathy is human nature. Empathy is very important in healthcare to be able to understand what someone is going through and to connect with them, to get on their level. But you could see the problem with empathy in healthcare is that we are surrounded by the emotional, physical, or spiritual suffering of other individuals. And if we are absorbing all of that suffering, that's going to be very, very overwhelming and fatiguing for us and our bodies. When we feel an overwhelming sense of connection to someone else's pain, this is our empathy being fatigued, not our compassion being fatigued. Empathy is required for all roles in healthcare and required to understand what somebody is going through and want to help them. The ability to understand the pain of others leads us to take that step to reduce their pain. but it can also paralyze us when we're filled with empathy, filled with somebody else's distress and pain. So the key is really a balance. You don't want to be devoid of empathy, but you also want to refrain from internalizing those emotions so that you yourself are distressed and overwhelmed. And I'd like to challenge you here to, instead of saying the words compassion fatigue, to start saying the words empathic distress, because that's really what is being fatigued, our empathy here. And in empathic distress, we discover that through our empathy, when we're internalizing those emotions, that can produce negative feelings inside of us. So when we're internalizing somebody else's pain and stress, we ourselves feel that pain and stress. And that leads to poor health outcomes. Chronic stress has a lot of chronic health outcomes, and it can also lead to burnout as well. Social isolation and withdrawal go right with empathic distress because we want to try to protect ourselves from that negativity, from those feelings of stress, from that trauma that we're being exposed to. So it can really lead to a caregiver feeling as though they just don't have anything left to give, that they're exhausted, and that they don't want to go to work because they don't want to continue to live the experiences of their patients. Compassion, on the other hand, is an other related emotion. So when we're feeling compassion, we're concerned for another person, but we don't have that same internalizing going on of the other person's emotions. We still have that separation of self and other. We are aware of the other person's feelings, but we have a boundary in place where they're not overwhelming us, or we are not internalizing them to the extent that we feel distress. Compassion is associated with positive feelings like love and connection, and those feelings have been associated with good health. So compassion is associated with better health outcomes. And it also allows us to continue to lean into these situations, and continue to help people and give ourselves. So really, compassion fatigue is a misnomer, and what we really should be talking about is empathic distress fatigue, which brings in a whole new level, a whole bigger picture of what we're talking about when we look at the definition of empathic distress fatigue. Empathic distress fatigue is a strong, aversive, and self-oriented response to the suffering of others, accompanied by the desire to withdraw from a situation, disconnect from those who are suffering, and adopting depersonalizing behaviors in order to protect oneself from excessive negative feelings. So when we think about empathy and compassion, again, it is important to remember that empathy is good, but what we don't want is that empathy to cause us distress, to cause us vicarious pain, to live the other person's experiences. So if compassion promotes these positive feelings and produces better health outcomes that are associated with wellness and resiliency, and offsets the negativity of empathic fatigue, well, then we can use it to decrease or prevent empathic distress fatigue. There's a very interesting scholarly article I linked for you all in the materials entitled Compassion Doesn't Fatigue. And researchers are really broadening this field of research in neuroscience about compassion and empathy and compassion training. And it's very fascinating to learn about that compassion. We can always produce compassion. We can always wish other people well. When we aren't internalizing those negative emotions, there is no limit to the amount of compassion that we can give to others. And cultivating compassion has been shown to be the solution to easing empathic distress. Compassion can be strengthened like a muscle, and this can be done in as little as 5 minutes per day and can lead to measurable changes in neural functioning. It's important to note that compassion training does not entirely reduce or remove those negative feelings, but it rewires your brain to increase activation in brain areas associated with love, hope, rewards, and sets your default to using that neural pathway of compassion rather than internalizing those feelings. So if we're trying to shift the balance from internalizing our clients' emotions and purely empathizing to feeling for our clients and feeling that compassion, well, how do we do this? So there are a few ways that I'm going to talk about here. The very first step is going to be some self-reflection. So to take a baseline of where you are at right now, your current state, do you see the signs and symptoms of compassion fatigue in yourself? Are you exhausted at the end of the day emotionally and physically? Do you feel as though you just cannot give enough of yourself to make a difference, or you're not satisfied in the work that you're doing? Do those feelings stick around with you even when you've clocked off? There are some very important questions to ask yourself and to take stock of how you're doing right now. The next practice is to start practicing self-compassion. So with self-compassion, we give ourselves the same kindness and care that we would give to a good friend. People should feel compassion for themselves because all human beings deserve compassion and understanding, not because they possess some particular set of traits like being smart or funny or talented. This means that with self-compassion, you don't have to feel better than others to feel good about yourself. Self-compassion also allows for greater self-clarity because personal failings can be acknowledged with kindness and do not need to be hidden. Self-compassion isn't dependent on external circumstances. It's always available, especially when you fall flat on your face. Then the last step that I'll talk about here is sharing that compassion outwards. One way that we can do this is through a commonalities practice. So it can be very difficult to focus on the similarities between people that we don't necessarily get along with or that we have a lot of differences with. But a commonalities practice can shift your view to help you focus on those similarities rather than the differences. So if you have somebody that you are struggling with, you might bring them to mind and repeat to yourself, just like me, this person is seeking happiness in their life. Just like me, this person is trying to avoid suffering in their life. Just like me, this person has known sadness, loneliness, and despair. Just like me, this person is seeking to fill their needs. Just like me, this person is learning about life. And then the last practice that I would like to highlight is mindfulness. So this has been the strategy that neuroscientists have used as an intervention for studying whether or not compassion can be trained in people or cultivated in people. So this meditation, we will go ahead and watch a very short clip here, and it will lead you through a couple of things that you can do anywhere at any time to promote compassion for yourself and for others as well.
I invite you to settle in. Allow your breathing to become natural. And place your hands on your heart in whatever way is comfortable for you. And please repeat after me. May I be happy.
Oops.
May I be healthy. May I ride the waves of my life. May I find peace no matter what. And now bring to mind images of those you love, or perhaps a particular person you most deeply want to send loving kindness to today. May you be happy. May you be healthy. May you ride the waves of your life. May you find peace no matter what. And now we bring in the entire world, those we love, those we struggle with, those we love we just haven't quite met yet. May we be happy. May we be healthy. May we ride the waves of our lives. And may we find peace no matter what. I wish you well. I invite you.
All right.
I invite you to.
So now I have a colleague who mindfulness is not her cup of tea. Meditation is not her cup of tea. And that is one of the ways that has been shown to strengthen compassion, but a factor of resiliency for compassion fatigue is going to be having more generally really good self-care or self-care strategies. And so I'd like to take a moment to talk about self-care in a more general sense here. Self-care is really so important for our general wellness as caregivers, and poor self-care is a risk factor for compassion fatigue. If we aren't able to care for ourselves, how are we going to have the energy and capacity to care for others? Now, Maslow's hierarchy of needs, which you have here on your screen, might be a really good tool for you to use when you're thinking about how to prioritize your self-care. At the very bottom of Maslow's hierarchy of needs, we have our most fundamental needs, so our physiological needs of our bodies. And these are things like food, water, warmth, and rest. And these can be very easy to overlook, the importance of getting 8 hours of sleep a night or staying adequately hydrated throughout your shift. But these are going to set the stage, set the foundations for your health more generally. So the next distinction that I'd like to make is self-care versus self-soothing. So self-care can be very easy to say and harder to implement into your life. And it's easy to fall into the trap of saying, well, if it makes me happy, then it's self-care. But to define self-care, self-care provides the opportunity to grow and heal and allows for long-term relief of stress. Self-soothing, however, provides a distraction from or temporary relief of pain and stress. stress. Both of these are very important at different times, and it's important to be aware of which practice you're engaging in. So self-soothing might constitute coming home after a long day, sitting down, you're so exhausted, you don't have time to make dinner or the energy to make dinner, so you grab some ice cream and watch some Netflix. Now, this has you have a need at that point to provide some distraction or temporary relief of your pain or stress. But in the long run, that is not what is going to allow you to grow and heal. So the reason that it's important to be aware of which practice you're engaging in is 3, 4 months down the line, when you've been engaging in what you think is self-care and you're not seeing those results, it might come down to the fact that you are engaging in more self-soothing practices than you are engaging in sustainable self-care practices. And like I said, I am not shaming self-soothing. Sometimes we need self-soothing, especially in a time of heightened stress in an unprecedented time in our lives like this one. Our situations have changed, and so should our expectations of ourselves as well. So in this current pandemic, in the age of COVID-19, some things that are going to increase our resiliency and our wellness are going to be striving for those fundamentals of self-care, really, really valuing the bottom of that pyramid. Rest, adequate hydration, getting enough sleep. It's very important to practice positive self-talk and self-compassion, and to limit your news consumption, because as empathic people, it can be very hard to have boundaries when you're watching the news from your emotions and the suffering that is going on. So you can really internalize a lot of that and feel a heightened stress response from that, which has those poor outcomes associated with it. So you could look at this very cool resource that I have called it's a YouTube channel called Some Good News. And it's a very interesting concept where this actor, John Krasinski, who was in The Office, he puts together a YouTube show comprising of all of the good news that is going on that might be swallowed up amidst all of the negative news happening. And then the next point that I'll bring home is to create some sort of ritual. If you are struggling at work and you are having a hard time not internalizing all of the craziness that is happening in our lives right now, this going home checklist can be very helpful. So taking a moment to think about your day, acknowledging one thing that was difficult on your shift, asking yourself how it made you feel, what was difficult about it, considering 3 things that went well, telling them to somebody that you trust, and then checking in with your team. If they're not okay, what assistance do they need? And that might not be assistance that comes from you. That can be resources that you give to them as well. Are you okay? Who can you talk with if you need to share? Identifying that person for yourself. And then focusing your attention on going home. Perhaps even creating a ritual that you do when you're going home to try to get yourself out of that work headspace and into the home headspace where you can focus on being home. So one ritual that I have heard from a student in one of our classes was that every day after she got done with work, she would go change out of her work clothes and shower. Not necessarily because she needed to shower, but because that was a ritual that was very cleansing for her, not just in the physical sense, but when she showered and got out, then she emerged into her home life, and that was where her brain was. And then focusing on those fundamentals, focusing on rest, recharging, eating healthy, drinking water, forming connections with others, and moving your body in some way that you enjoy. So this is particularly important, speaking about compassion fatigue and self-care during the current pandemic, because there have been some very challenging outcomes of this pandemic and very challenging environments that we might be forced to work in. This article excerpt that I will read comes from an article about an ER doctor who died by suicide. And it reads that even after coming down with the virus herself, Dr. Lorna Breen remained determined to get back to work at the 200-bed hospital where she and her colleagues provided care to as many as 170 COVID-19 patients. But when she did recover and return to work, the ER doctor found herself struggling to make it through her regular 12-hour shifts. Her father told the New York Times that his daughter had no history of mental illness, but said that when he last spoke to her, she seemed detached, as she described how distressing it was to have watched so many patients die, including some who had never even made it out of the ambulance. The stress, trauma, and isolation associated with the coronavirus pandemic may create a perfect storm among medical professionals, many of whom are already at an increased risk of death by suicide. So this story really exemplifies why we need to be so vigilant about our wellness and the wellness of others. And when we think about promoting resiliency, we've talked about some ways to promote resiliency within ourselves, but how can we take that to a systems level? How can we take that to a more preventative level for everyone within our organization? So I have a few different examples of programs or activities, that strategies that you could implement into your organization if you have the power to do so, or bringing it up to the people that have the power to implement those strategies in your workplace. So the first of which is to simply train staff in compassion fatigue and self-care strategies, so that education surrounding it and normalization of the conversations surrounding compassion fatigue and self-care strategies are going to be such a protective factor against them. Employees should develop individualized self-care plans, and that could also include periodically reviewing those with peers or with a mentor, and doing revisions to those as well, finding out what works and what doesn't work in your life. Peer support groups could be very helpful at this time, or pairing individuals who don't have as much familiarity with compassion fatigue or self-care strategies with somebody that does, and having that mentorship, that connection between them. Creating a culture of open dialogue, connection, and appreciation. Having structured wellness breaks, which could include meditation or yoga, lunch and learns on these topics, aromatherapy, walk groups. There's so many options to create structured self-care into the workplace. Support and modeling of self-care by management and administration is very important for that normalization, so that employees know that they are encouraged to think about their wellness and have those self-care strategies, prioritize their health. This could include employee assistance programs and ongoing encouragement to use employee assistance programs. And then the last point I'll make is that you might consider administering a compassion fatigue self-assessment to track your progress, to do a research project where you start by administering a baseline compassion fatigue self-assessment that's individual for each person to know in your organization, and then start to try to implement some of these strategies and see what works by administering those compassion fatigue assessments again. To highlight an assessment that's very helpful, this is in the materials as well. The Professional Quality of Life Scale has been used for over 15 years to measure the positive and the negative aspects of helping, and it helps to measure compassion fatigue. So if you are interested, the link is in the materials section here. Then lastly, I'd like to share a few resources with you before I open it up for discussion for our last few moments. So the Compassion Resilience Toolkit is such a helpful resource. It's free. It offers information, activities, and resources to understand, recognize, and minimize compassion fatigue and promote resilience. There is a toolkit specifically for healthcare leadership and staff, and it is designed to be implemented in smaller sections over a longer period of time. So implementing these into staff meetings, for example. The next resource is selfcompassion.org. Dr. Kristen Neff has this website, who is a huge advocate for self-compassion, has a ton of great resources on this topic if you are interested in learning more. And then I've also linked a few articles that go over some of the very interesting research in neuroscience about compassion, compassion fatigue, and compassion training. So for the last few minutes here, we have about 10 more minutes. I'd like to see if anyone has any more ideas for things that you might do to promote resilience in your organization or in yourself, anything that you would like to share. And if anybody would like to share by talking, I'll go ahead and unmute everybody, and you can speak up if you have anything to add that might be helpful to the group. Diana said that she's just starting to figure out how to direct that conversation around self-care. It's not a one-size-fits-all situation. Absolutely, Diana. It is going to look different for every single person and going to have to be implemented in different ways for every single organization as well. Okay, so then the last thing that I would like to do here, well, I'll read Lisa's comment. She recognizes a time that she experienced it, plans to check in regularly with her coworker, and to have an outlet to discuss their current state. That is awesome. Yes, we can absolutely utilize one another to help each other out in this time. Okay, so the last activity we have here to do is very optional. I understand this is not everyone's cup of tea, mindfulness or meditation, but this is about a 4-minute practice here, and we will end by going through some guided self-compassion. And if you are going to log off now, please feel free to do so. Thank you all for joining us. I am so happy to have been able to share this with you. And I really hope that you can take some of these strategies with you individually or to your organization and promote wellness within your organization.
This practice is called the self-compassion break, and it's something you can do.
No, okay, sorry. There we go.
Break, and it's something you can do anytime during the day or at night when you need a little self-compassion. So to practice this exercise, we actually need to call up a little suffering. So I'd invite you to think about a situation in your life right now that is difficult for you. Maybe you're feeling stress, or you're having a relationship problem, or you're worried about something that might happen. I'd invite you to think of something that is difficult, but not overwhelmingly difficult, especially if you're new to practicing the self-compassion break. So finding a situation and getting in touch with it. What's going on? What happened? Or what might happen? Who said what? Really bring the situation to life in your mind's eye. And then I'm going to be saying a series of phrases that are designed to help us remember the 3 components of self-compassion when we need it most. So the first phrase is, this is a moment of suffering, right? We're bringing mindful awareness to the fact that suffering is present. And I'd invite you to find some language that speaks to you. Something like, this is really hard right now. Or, I'm really struggling. We're actually turning toward our difficulty, acknowledging it, naming it. This is a moment of suffering. The second phrase is, suffering is a part of life. Okay, we're reminding ourselves of our common humanity. Suffering is a part of life. And again, finding language that speaks to you. It may be something like, it's not abnormal to feel this way. Many people are going through similar situations. Right? The degree of suffering may be different, the flavor of suffering may be different, but suffering is a part of life, part of being human. And then the third phrase is, may I be kind to myself in this moment. And to support bringing kindness to yourself, I'd invite you to perhaps put your hands over your heart or some other place on your body that feels soothing and comforting. Feeling the warmth of your hands, the gentle touch. Letting those feelings of care stream through your fingers. May I be kind to myself. And using any language that supports that sense of kindness. Perhaps language you would use with a good friend you cared about who was going through a very similar situation. It may be something like, I'm here for you. It's going to be okay. I care about you. You can even try using a diminutive if that feels comfortable. Oh, darling, I'm so sorry. Or you can try calling yourself by your first name. Anything that feels natural to express your deep wish that you be well and happy and free from suffering. And then letting go of the practice and noticing how your body feels right now. Allowing any sensations to be just as they are. Allowing yourself to be just as you are in this moment.
All right. Thank you all so much for being here. This concludes our webinar on compassion fatigue, and I hope you all have a wonderful day and a wonderful weekend.